Every year in Kenya, about 40% of all outpatients and another 20% of inpatients in hospitals are there due to malaria. Kenya loses about 170 million working days to the disease each year, with the most vulnerable group being pregnant women and children under 5, of whose deaths malaria accounts for an estimated 20%.
Malaria has the highest incidence, especially, and it's a threat to both pregnant women and children below 5 years of age.
Every pregnant woman is highly likely to be infected with the parasite. And these parasites, they go and hide in the placenta. And so if a pregnant woman is not accessing the SP every 4 weeks as is required, then it means that the parasites continue to pose a risk both to the pregnant woman and to the unborn child.
Women's immunity due to the presence of a new organ, the placenta, places them under immense threat. With new places for parasites to bind themselves within the placenta, pregnant women are highly vulnerable to malaria infections that can have adverse effects on them and their unborn children. It is due to these grave realities that the government established a national malaria strategy in 2009 to curb the disease in endemic areas.
Path Kenya, through the Western Kenya project, the Afya Plus project, Western Kenya, actually has engaged with supporting the government and supporting the districts in this region to implement a number of strategies that are meant to help the population of this area. Now, one of the areas where we continue to work in is in malaria control. And in malaria control, especially for pregnant women, we have seen that over the years there hasn't been good progress, in this region. If you look at what the national malaria strategy says, we need to have at least 80% of these pregnant women who live in areas like this to really be provided with interventions which help them prevent malaria during pregnancy and indeed control malaria if it does occur during pregnancy.
One of the interventions involves expanding intermittent prevention treatments of malaria in pregnant women in high transmission areas. Despite the government's efforts to step up malaria control measures, cases in pregnant women continue to grow, while women and children have access to bed nets that they don't use. These are usually provided at antenatal care clinics along with other preventive treatments. Unfortunately, not all women attend the clinics early enough.
There was a program in place, and for years this program is in place, but it wasn't performing because we ask women to come to the health clinic. Sometimes it's not difficult, sometimes it's very difficult. Mothers, they need to walk a long way to come.
At the same time, healthcare facilities have continually grappled with drug shortages that may force pregnant women to occasionally miss out on preventive treatments. To overcome these challenges, the Malaria Control and Evaluation Partnership in Africa, which is an initiative of Program for Appropriate Technology in Health, has successfully developed a program to increase pregnant women's access and uptake of preventive malarial treatments.
We have done this in Kisumu West area, specifically the communities of Kanyawegi where we are, Osiri and Ojola, to make sure that all the eligible women who are in this area do access the prevention of malaria during pregnancy.
The new approach targets women who don't receive antenatal care and preventive treatments by incorporating community health workers who not only raise awareness on the importance of preventive measures, but also bring treatments closer to the pregnant women's homes.
I would urge others to be ready to talk to CHWs whenever they came to your house, and be free to tell them whenever you missed your periods, so as to help us getting the exact months for starting the IPT.
The results show that both patients and health workers appreciate this new approach, as evidenced in a 50% uptake of preventive measures against malaria.
Tangu tuanze hii kazi, tunaona kama area wetu watu wako safi, hata kwa area, hata kwa nyumba, hata ukienda kwa boma, unaona kama boma kila kitu iko safi, rack wamejenga, choo iko, wamefyeka bushes iko around. Sasa Tena tunaambia hawa ati usiweke nini maji ile imesimama na mkebe, stagnant water usiweke karibu, italeta umbu.
Before this project started, we were having so many cases of malaria in the community. Most mothers actually were coming with malaria, and we were treating them. And when we started now this intervention at the community level, in line with the community strategy policy, we find that cases of malaria at the community level has actually gone down tremendously.
For 35-year-old Alice Atieno, who is both a community health worker and a beneficiary from Kadea village in Kisumu West constituency, adhering to the required interventions has been a blessing to her family.
When you have malaria during pregnancy, you will get a low birth weight baby. And that have given me to have a good weight for my baby. And I am happy to have a good baby.
We've really appreciated the project, and it's really improved the number of visits that we see from pregnant women in the facilities, and also the uptake of the FANSIDA per visit. And the fact that it includes the community health workers to assist us to ensure that the mothers do visit, they do come for ANC visits at the facility.
Although the initiative offers viable solutions to the Nyanza region's statistics on maternal mortality rates, there have been challenges.
We were lacking regular data review to ensure that whatever the community were reporting were of quality, because it was just a new program, and therefore they were still not so much conversant with the tool which they were using to collect data.
Moving forward, stakeholders will need to do more to increase adoption of the initiative in malaria endemic regions.
I'm a